Good morning. Good morning. Think that that's me that needs to begin. I just wanted to say thank you to the Community Action Network of Healthy Start for bringing all the brilliant minds together this morning to talk about, at their third annual breakfast, we want to make Black moms matter. The goal is to hopefully be able to focus on reproductive justice and to be able to make sure the community knows what their needs are about their bodily anatomy and advocating for quality health care. Thank you for having me this morning. I think my experience, while not personal and immediate, I know that when I've needed to connect a young woman who was an expecting mom, who was having a heart health emergency and was not sure exactly where to turn to get what she wanted. I was blessed with being able to reach out to Healthy Start to help to connect her not only to a doctor who would treat her, but they developed a plan for support and made sure that they worked to understand what her family needs were to get her everything that she needed. And all I had to do was make a phone call. So I know that they've always been there. I happen to know some of the young ladies personally who work there. They're fantastic. Jada is a staunch supporter of women. Ashley is another staunch supporter of moms. I'm excited to hear what Lindsay and what LaTasha and what some of the other representatives have to say this morning. So I would just say, ladies, everyone who's online, get comfortable. Hope you have a cup of coffee or a cup of tea. Thank you for joining us this morning. And with that, I'm just going to say, excuse me, Representative Lindsay Williams. Good morning.
Good morning. Thank you so much. Thank you, First Lady Gainey, and thank you to everyone who's taking time out of their Friday morning to be here to talk about such an important topic, reproductive justice and maternal mortality, particularly for Black parents and families. As I said, I'm State Senator Lindsay Williams, and I have the honor to represent Senate District 38 here in Allegheny County, which includes the North Hills suburbs, Allegheny River Valley, and the 10th, 11th, and 12th wards in the city of Pittsburgh. So I'm tasked with talking a little bit about what's happening at the state level, specifically maybe in the state Senate. Back before the pandemic began, I had the chance to participate in a program at Magee Women's Hospital that focused on the need to expand Pennsylvania's Medicaid coverage to what we call the fourth trimester. That means providing long term coverage to postpartum individuals, not just one or two brief follow up visits. Really giving new moms the time to discuss all of the changes that they're experiencing with their body, with their doctor, is incredibly important for both their mental and their physical health. And thanks to Governor Wolf, we were able to do just that in January of 2022. So now, instead of just 60 days, Medicaid covers 12 months of care for new moms. That increase in coverage is just, one. We're addressing maternal mortality, but we know there are so many other policy changes that we need to move the needle further in addressing our really terrible rates of maternal mortality. Things like instituting paid family leave for parents, quality, affordable childcare for all kids and all families, raising the minimum wage so parents don't have to work multiple jobs to support a family, improving public transportation access to ensure that everyone can get to medical care, requiring training and culturally competent care for providers. Because we've heard the stories about how, women and specifically Black women are treated sometimes when they see a physician. So, there are things that will make a dramatic impact that don't necessarily sound like initially maternal health care. They're all the things that go into making a family have the care they need. So, even changes that are small in terms of budget needs, like my legislation for free meals to Students makes a huge difference in families by fighting hunger. So, Democratic members of the Senate are working towards these policy goals through legislation. We're also introducing legislation that would protect our reproductive freedoms. Because Democrats are in the minority in the Senate, we don't expect to see a lot of movement on our legislation. But this year, for the first time, the House has a Democratic majority, and I know some of our panelists later in the day will be talking about this, but for the first time in over a decade, we're expecting to see some good policy come over from the House. So the House and the Senate are going to have to work together and make some compromises, which we hope will make a real difference for families, that Senate Republicans will feel some pressure with all those bills coming over, that we move at least some of them. The House Democratic majority also means that, well, I want to knock on wood because I'm a little superstitious, but means that the abortion constitutional amendment that we passed last session won't come out of the House. The constitutional amendment has to be passed in identical forms in 2 consecutive sessions. So SB 106, the abortion ban of last session, only passed the chamber once, which means even if we pass it out of the Senate again, the House isn't going to take it up. So that is a real impact on the lives of everyone here in Pennsylvania. And you made a difference in protecting at least that piece of reproductive freedom here in Pennsylvania. But we can't stop there. Access has to be meaningful. It can't just be that you have the right, it's how can you access that? So we need to continue working on that justice piece of reproductive freedom. That means some things like the largest employer in our region, who happens to be a healthcare provider, is providing a fair wage and not charging so much for healthcare that those employees are in their own healthcare debt. That's culturally competent caregivers in our local neighborhoods and real support for working families. So I want to thank all of you for the work you've done so far. Please celebrate your wins, because sometimes that's hard to remember to do, but let's keep moving forward, and I look forward to working with all of you. Thanks so much.
I'm muted. Thank you so much, Senator Williams. We really appreciate you taking the time to be here with us this morning for our legislative breakfast. And also thank you for all the work that you do. Now I am excited to announce our keynote speaker. We will be hearing from Representative LaTasha D, a representative for the 24th District. And without further ado.
Good morning, Healthy Start. It's an early start for all of us today. I am overjoyed to be serving as your keynote this morning. And as I get my tech together over here, I want to start by expressing my admiration for Jada Sherrill, the Executive Director of Healthy Start Pittsburgh, my friend, my sorority sister, and my ride or die in this work for Black maternal health and reproductive justice. So I want to start by thanking her for her leadership and her vision and her incredible work over, we're pushing towards a decade, Jada, in this region, but really across the Commonwealth. So I want to thank you for all that you do to care for Black mamas within our region. And you continue to inspire all of us in the ways that you move as a powerful force for Black maternal health. I want to also thank you, Ashley. Thank you for the invitation to be part of this special day. You know how I feel about Healthy Start and the work that you all do, and for your work in the community, Ashley. It is great to have the opportunity to continue working with you in my new role. So as Ashley shared, I am Representative LaTasha D. I use she, her pronouns. And I represent the mighty 24th Legislative District in the city of Pittsburgh. And for those of you who don't know, this district is a new district. it is a different district. It was at the end of 2021, the 24th changed dramatically. And so now my district starts in Oakland at the University of Pittsburgh. We go up into the Hill District, across to Bloomfield and Garfield, over to East Liberty. I also have the neighborhoods of Stanton Heights, Morningside, where I live, and Highland Park, all the way over through Lincoln, Larimer, Homewood, and East Hills. So that is the 24th legislative district. And I want to start by saying, of course, offering any state-related services to anyone on this call, especially if you live in my district.
That's my cue to exit. Huh?
Someone needs to mute themselves. So if you ever need any state-related services, please do not hesitate to reach out to my office, which is located in the Hill District. You can find all my information at LaTashaDmays.com, and you can always call my district office at 412-665-5502. So that is the district. I have an incredibly unique district. I am 3 months into my new role, and I'm not wasting any time. And it is important for me to note that representation is critical to a thriving democracy. To put my role as a state representative in perspective, I am the first woman to ever represent the 24th legislative district in over 50 years since it was created. I am the first openly lesbian woman to ever serve in the Pennsylvania General Assembly, and that's the House of Representatives and the Senate. But I also want you to know that there are 203 legislators in the House of Representatives, and there are 11 Black women. And I am the only Black woman from Western Pennsylvania. So I want you to keep that in mind as I go through my remarks, because I'm going to talk to you about the power of the transformative power of reproductive justice. Almost a year to the day, I was a featured speaker for Healthy Start, and it actually was my last speaking engagement as president and CEO of New Voices for Reproductive Justice. Many of you know me or are familiar with the work I led for 18 years, going back to 2004. Yesterday, March 16th, was actually the 19th anniversary of the founding of New Voices. And I will always speak the names of our founders, which includes me, Bekezela Mguni, Lois Tony McClendon, and Maria Dautruche. So we had a vision to create something for young Black women in the city of Pittsburgh when we were really fresh out of and still in college. And we also knew that we had to work within the community and work with the elders in the community. And we have been guided for so many years by, as some of you know, Tony McClendon. We call her the Grand Dame. But that was our calling in 2004. So if you know anything about me, you know that reproductive justice is the work of my life. So no matter where I go, no matter what I do, reproductive justice is at the center. It is how I see the world. It is how I lead, and it is how I live. So in my first term as a state legislator, it's extremely special to me to know and witness for myself that all those years of policy advocacy, all those years of fighting to pass legislation in Harrisburg, and all those years of community organizing has its imprint in our state capitol. I hear my colleagues in the Women's Health Caucus and in the state Senate and other advocates talking about reproductive justice. I hear my Black women legislator colleagues or my sister reps talking about reproductive justice. This is the impact that, as the founder of New Voices, just motivates me now as a legislator to increase the stakes for what we can achieve on Black maternal health and continue the culture, continue influencing the culture of the Pennsylvania General Assembly with the core values of reproductive justice. Now, when I talk about reproductive justice, I always start with the fundamentals. Reproductive justice is a movement created by 12 Black women in 1994. And you may be most familiar with the mother of our movement, Loretta J. Ross, who was named a MacArthur Genius late last year. And it is rare that they choose an organizer for this type of honor. But it was the power of her work that has changed so many of us, that has changed me, that has changed this movement for Black women's health and social justice, for reproductive rights and social justice. That's where it comes from. Reproductive justice is that intersection of reproductive rights and social justice. So Loretta Ross, she is a mentor to me and to so many. She has been a mentor since 2004, since before we started New Voices. And without her decades of visionary leadership, this conversation right here, this legislative breakfast, is not possible. New Voices for Reproductive Justice would not exist. And there would not be an international movement of Black women, women of folks of color, and Indigenous women and folks without that genius of Loretta Ross and the other Black women who created this foundation for us. As a movement with a name, we are close to the 30-year milestone, which is mind-blowing. But this movement is an extension again of the vision of Black women. Since we stepped foot on these shores, from midwifery to contraception and abortion access, to Black feminist movements, to the Black women's health movement. These are all in the foundation of reproductive justice. So reproductive justice is a social change movement. It's how we are building power across this nation and around the world. But it's also a framework, how we think about issues and policies. It's based in human rights. So it's not based on our Constitution. It's based on human rights. Because we exist, we have human rights. And this framework is distinct from reproductive health and reproductive rights. But reproductive justice is also a practice. It's how we carry out the work that we do. It's also how we live our lives. So we all have the human right to control our bodies, our sexuality, our gender, our work, our reproduction, and the ability to form our families. Now, I know I'll probably sound like a broken record because we've been saying this for decades. We all have the human right to control our bodies, our sexuality, our gender, our work, our reproduction, and the ability to form our families. So I'm going to take you back because in the beginning of our work, it was really hard to make reproductive justice real or concrete. And it was because we were new to the movement. And we also were learning and also trying to understand it for ourselves. But when we talk about our lived experiences as the expertise for being part of a movement for reproductive justice, when we can get people to talk about what is happening in the fullness of their lives or what is happening in their reproductive life, then we can bring out of that conversations that lead to action around the racism and misogyny a Black woman or person may experience. The lack of access to healthcare, the inability to afford contraception or have access to reproductive healthcare through your insurance, be it public or private or employee sponsored, or discrimination you face in healthcare because of your sexual orientation, or how we don't teach young people about their bodies or provide that type of education in our schools, or how so many Black women have experienced sexual abuse or violence, or the inhumanity of being incarcerated as a mother or a pregnant person. It was talking about all this and more that helped our Pittsburgh community and eventually our Philadelphia and Cleveland communities to understand reproductive justice. The change of our mission about maybe 10 years into our work, a mission that focused on the health and well-being of Black women and Black femmes and Black girls and gender expansive folks, is what accelerated the growth and impact of New Voices and that vision to expand into multiple cities and states, because there is no one who can speak for us but us, or act for our human rights for us, or to change the power structures so that we can liberate ourselves, our families, and communities. No one can do that for us but us. And that's what the reproductive justice movement has taught me over and over and over. We have within ourselves, we have within our families, we have within our communities what we need to get what we want for our health and our well-being when we want to bring our children into the world and for their lifetime. So reproductive justice is transformative, and it can change lives. It can change people. It can change communities. I've seen it. It can change institutions. I've seen it. And it can change power. And that power comes from intersectionality. This idea that our identities are complex, the systems and institutions of oppression are complex, and the result, the systemic racism and patriarchy and economic injustice and transphobia, homophobia, and all the discrimination, all of those things work together. And some would argue, you know, being who we are in our experiences, Black women and folks, that would be our detriment. But I know it is our superpower. And that's why reproductive justice has been transformative. Now, make no mistake, there's so much that needs to happen, and we have to harness the power of reproductive justice to at least to affect the work that you all are doing on the ground here in Pittsburgh and wherever you may be listening from. But in our House of Representatives, in our state Senate, it is critical that we take that life force of reproductive justice that has taken me and so many others to different places where we have the opportunity to impact change at a greater level, at a higher scale, where our impact can change generations. So for me, Black maternal health has always been, these past, I would say, actually, I'm gonna take it back. How I and New Voices came to Black maternal health work was through our advocacy around mass incarceration. So this was one of the turning points in our organization where we were really trying to make it real for people what reproductive justice meant. And so the first policy, true policy, intersected with community organizing work was when we challenged the Allegheny County Jail for shackling pregnant incarcerated inmates. Now, we were looking at that from a purely incarceration perspective. But that was the beginning of our Black maternal health work, and that was 2009. But we didn't understand it then as we do today. So that was Black maternal health work too. And so while we were fighting to end the shackling
of pregnant incarcerated inmates, you know, it was connected to other related issues. We ultimately were able to ban shackling locally in the sheriff's office when they were transporting inmates to different appointments. And we were able, as part of a statewide collective, to pass an anti-shackling bill. But it only barred shackling in the third trimester. So ever since then, we've always advocated that there should never be shackling of pregnant incarcerated women and folks, birthing folks. So that's that origin for me. That's where it started. And then to have the opportunity to work with organizations like Healthy Start and those across the Commonwealth has really put the issue of Black maternal health at the forefront in the Pennsylvania General Assembly. And I want to give so much credit and so much appreciation and gratitude to my sister rep Morgan Cephas out of Philadelphia. She worked along with her colleagues and New Voices to really advance this work as a part of the Women's Health Caucus. I'm going to take a moment right here to tell you that I'm succeeding the work that Rep. Cephas did as she was subcommittee chair on the subcommittee chair for women and girls of color that really existed within, we have a bunch of caucuses in the House of Representatives. And so that subcommittee existed within a Black caucus. So now, earlier this year, I was appointed as the subcommittee chair, but it's now a joint subcommittee between the Black caucus and the Women's Health Caucus. So that's that intersectionality piece, because these caucuses need to work together in order to advance a priority like Black maternal health. And so I'm proud to continue the work of Rep. Morgan Cephas. And what she was also able to do was introduce several bills around Black maternal health, around doula reimbursement, morbidity and mortality data collection, maternal morbidity and mortality data collection, as well as a bill around implicit bias for healthcare providers. But we didn't, because we were in the minority, as Senator Lindsey Williams said. But another huge thing is we have a huge opportunity as a majority in the House to move bills through our committees, through the process, which is far more arduous than I can really express to you today. Maybe that's another workshop. But what it's going to take to move these bills out of committee to a floor for the vote, which has to happen multiple times, as well as to the Senate. But this is our time. This is our time to get it done. We have a House that wants to see it happen. We have a governor and lieutenant governor who want to see it happen. And so many of you on this call and other stakeholders who want to see these kinds of bills advance. Rep. Cephas introduced a new bill, and Senator Williams referenced this before, to extend postpartum care from 60 days to 1 year. So that was implemented over a 4-year period through the Biden administration, through the American Rescue Plan, I believe, that provided the funding to ensure that we could extend that care. But now we want to codify that into law. And so Rep. Cephas has introduced this bill as a law, and I certainly will be a co-sponsor on this bill and working to move it through the House of Representatives. But that's not all we can do. There's so much more. There's so many pieces of state level government that can have an impact on what happens to Black mamas here in the Greater Pittsburgh region and across the Commonwealth. And so that's where you all come in, because we want to hear and know from you, the practitioners on the ground, what is needed. And I was really excited to hear about the centering pregnancy model that Healthy Start and the Midwife Center are instituting. And I asked the question, how can state level leaders, legislators, and policymakers support this work? Because we have to have bold vision and bold action for what we want to see changed. Again, I am one person of many, and we are connected to a really large apparatus where there's so many opportunities to create the changes that we want to see, not only for reproductive justice, but for Black maternal health and the health and well-being of Black communities. So now is our time to make it happen. And so one of the things I also wanted to mention is I received my committee assignments. I'm proud to say that I will be serving on the Appropriations Committee. And if you don't know what that is, that's the Money Committee. That's where we decide where the $44 billion, how that money is allocated. So, and we know that budgets are a reflection of our priorities. So I'm honored to have the opportunity to serve and the confidence in my leadership to be a part of one of the most important things, if not the most important thing we do as a legislature, which is to allocate, appropriate, approve, and pass a state budget. I also was assigned to the Judiciary Committee, another critically important committee, as it is about law enforcement. It's about our prisons and institutions. It's about pardons. And there are subsets of bills will come through the Judiciary Committee. We were able to advance the two bills from the House and Senate from the House around childhood sexual abuse. That was one of the first things. That was the first thing we did as a committee. So happy to serve, proud to serve. I know how important that committee is to the work in the 24th legislative district, but in the Greater Pittsburgh region, again, across the Commonwealth. I'm also going to be serving on the Environmental Resource and Energy Committee. Now, we want to talk about the first environment. You know, our elders have said to us, the womb is the first environment. So how are we making those connections? And lastly, I will serve on, this is what I've always wanted. I'll be serving on the Health Committee. So again, we have real opportunities to advance reproductive justice and Black maternal health. And I need you to help me and help my colleagues to make that happen. It can happen right now. We don't have to wait 5 and 10 years to figure out what we're going to do. We don't need to do any more research about the issue or the problem. We know what it's going to take. The solutions come from us. And I want to say thank you today for having me as your keynote speaker. Thank you, Healthy Start. And thank you to everyone who is out there listening. I appreciate you. Let's get to work. Let's get it done.
Thank you, LaTasha, for that. That was awesome. My name's Shantia Utterback. I'm with the Black Women's Policy Center, and today I have the privilege of introducing LaRaisha Rudolph for her testimonial. Before we get into that, I just want to tell you a little bit about Miss LaRaisha. She was born and raised in the Hill District area of Pittsburgh, and she is a certified nursing assistant and is the mother of a 2-year-old Lariah and a 9-month-old DeVale. LaRaisha is a Healthy Start participant since May of 2022 with her pregnancy of DeVale, her baby boy, and today LaRaisha will share her birthing story with us. Welcome, LaRaisha.
Hello, thank you for having me. So yes, my name is LaRaisha. To pretty much get into my son's story, on June 15th of 2022, I gave birth to a handsome baby boy. My son was born at 5 p.m. that day. I had noticed that he was breathing, kind of hard, and I had asked the nurse if she check on him. She advised me that, he was going to be fine. A few hours later, my son began to make, some unfamiliar noises that were very concerning to me. So I had pushed the nurse's call button and asked for the nurse to come into the room, and she examined my son, but she didn't notice the sound until she stood there for a little while. Once she noticed what I was explaining, she went and called the peds doctor. The peds doctor did not see what we were talking about. Later in the night, we were asleep when I had heard my son have like this piercing scream, like it's undescribable. I jumped up and looked over into the crib, but he was still asleep, like as if it wasn't him, but I knew it came from him. A couple other things began to happen over the duration of the time, vomiting excessively, only to consume 1 bottle within a 24-hour time period. I brought it to the nurse's attention again, and they advised me that they wanted to take my son to the NICU for observation to run some tests. I agreed. No later than 45 minutes later, I was informed that my son needed to be transferred to UPMC Hospital, Children's Hospital, where a surgeon would be calling me 5 minutes later to tell me that my son needed to be needed emergency surgery. With all that being said, I was still admitted at McGee's Women's Hospital because I just gave birth to him hours before, hours after. I'm sorry. Um, which once they said he had to get the surgery, I asked numerous times what was going on, and I didn't get a straight answer. My son was diagnosed with NEC, which for whom doesn't know is necrotizing enterolitis, which was so rare for my son because he didn't meet any of the requirements of NEC. Symptoms for NEC, for who doesn't know, are for premature babies and babies who are underweight. My son was 8 pounds, 8 ounces, born at 39 weeks and 6 days. My pregnancy was healthy all around the board. He already had to sustain 2 surgeries. One the day of the emergency surgery, and a month later he had to do another emergency surgery due to the first surgery not being successful. Those 2 surgeries had caused my son to have an ostomy bag, which delayed him from doing other things physically. He sees a physical therapist every week. He still has some recovering to do because throughout this process, he went through other health issues, dealing with his liver due to the TPN and lipids he had to be on for his neck problem. Also, he has real bad acid reflux due to that. Excuse me. I started off giving him breast milk, but as he got sicker, it caused me to be more stressed than usual, and it caused my milk supply to decrease. It didn't matter the food I was putting in me, the water, the sleep. It was just I was so worried about him that I couldn't have the milk supply. Which caused me to worry more because now he has to drink Similac, which, as everyone knows, if you don't, Similac was on recall, so I was very nervous about that. But now he drinks Similac Elementum because he can't digest cow's milk. I speak with PCP further about his next steps and options. The process was extremely hard with the limited support system I had being a single parent of 2 babies. It was excessive appointments, constant phone calls, constant appointments. It was ongoing. The day he discharged, I didn't believe that I still would practically be living in the hospital still. In the hospital, I was still trying to maintain my life outside of the hospital. I expected to go back to work after I had my child, but that wasn't possible. Of course, daycare was an option, but it wasn't an option because I wasn't financially stable to take care of the co-pays for both of my children. DeVale would have had to go to a certain type of medical hospital. He wouldn't have been able to go to just regular daycares. The past 9 months have been very challenging to me. I went through postpartum depression. I started seeing a postpartum therapist through Healthy Start, only because I couldn't provide financially constantly for my family. I always had to observe my child because of all the medical conditions he had. The family was afraid that they would do something wrong, so they just basically really wouldn't help. Over time, it became the new norm, and my life has adjusted. DeVale goes for a surgery on Tuesday to get the ostomy removed, and for the first time in a long time, it felt like I could breathe. Like the whole process, it felt like I was underwater trying to figure out everything. But now that stuff is picking up and I'm a little bit more comfortable with my son's condition, it's been okay, but like I said, I just feel like I can breathe. Yeah, that's pretty much everything that I have to say as far as what's going on, because that for mothers, to be a mom and to witness it, to be on the NICU floor, to see babies come, to see babies go, to see babies pass away, to see babies, basically past the NICU stage and go home to their parents, to go back, like the NICU phase is very scary for mothers. And all the advice that I can say for future mothers is keep going. You are your child's voice. You are the only voice for your child. So I feel as though speak up for your child. We are with our children 25/8. There's things that other people don't see that we do see. And I just want mothers to know that you are seen, you are heard, you know what I mean? Like, it's going to get better. Like, and I can say that because I've been in the most craziest situations, and I can honestly say things do get better. I do appreciate for being able to explain my story to you guys. Um, and I just appreciate you guys for having me. That's all.
Thank you, LaRaisha, for that powerful testimonial. Thank you for being vulnerable for everyone on here listening. My name is Sherelle Fulton. I am the co-chair of Healthy Starts Community Action Network, and I am here to introduce the moderator for our legislative panel. And I bring to the stage Ms. Rochelle Jackson, founder of Black Women's Policy Center. Ms. Rochelle?
Good morning, everyone. I am so happy to be here with you all. I would like to thank Healthy Start and the CAN Network for the invitation to join you for this very important legislative panel discussion today. As stated, I am the founding CEO for the Black Women's Policy Center. And I would like to welcome our panelists, which are Representative Emily Kincaid, Representative Dan Frankel, Representative Arvin Venkat, Representative Summer Lee. I think if she is going to be able to get on this side and join us, if she's not, she will be coming soon. But just to kind of set the tone a little bit, I just wanted to say that in 2015, prior to the overturning of Roe versus Wade, the National Black Women Reproductive Justice Policy Agenda released how the United States Supreme Court decisions that upheld the Affordable Care Act and kept open reproductive service clinics in Texas were real and crucial victories for the poor, the disenfranchised, and for Black women. But in the last few years, several state legislatures have enacted severe restrictions on the availability of safe abortion care. Black women are especially affected by this, as they already face greater obstacles than non-Hispanic white women in obtaining sexual and reproductive health services. As a result of these disparities, Black women have higher rates of sexually transmitted infections, reproductive cancers, and unintended pregnancy than any other women. So I would like to begin with the first question to all of our panelists. As Pennsylvania state legislators, what legislation is in committees that will help to create more access to reproductive health care across the state of Pennsylvania, and particularly for communities most left without access, like Black women?
I'm going to volunteer Representative Frankel as the chair of the Health Committee to start this out.
Yeah. Thanks, Emily, and thank you, Healthy Start. Thank you for inviting me to be part of this program. I'm Representative Dan Frankel. I represent 23rd District, right next door to LaTasha May's district, and what a great presentation she gave us this morning. And I've had the privilege over many years to work with her and hear from her and her advocacy for reproductive rights and Black maternal health in our community. And it's so refreshing to have her voice, not only in Harrisburg, but also on the Health Committee, which I am honored to be the chair of. And after 4 years of being in that position as the minority chair, having the opportunity to work with people like LaTasha like Arvin Venkat, who you'll be hearing from shortly, people who really get, not only Black maternal health, but dealing with real issues that affect Pennsylvanians across a broad section of our diversity, as opposed to what we've been doing for 4 years, which has been passing abortion ban after abortion ban, trap laws that restrict access to abortion care, fake medicine, anti-vaccine legislation. I mean, it's been a potpourri of craziness, and we finally have an opportunity to bring a rational agenda. And front and foremost will be, making sure that we continue to have access to abortion care, and we have legislation that's been introduced by a number of different members. You're going to be hearing about some of them as well. But one of those pieces of legislation is a piece of legislation that Representative Liz Fiedler from Philadelphia, who's also the chair of the Progressive Caucus in the House, and I are introducing, that basically will expand the scope of practice of different types of practitioners to provide abortion care. So one of the things that we know today, in addition to the fact that abortion care has become really inaccessible to many communities, including Black women, but also in rural communities, 87% of the counties in Pennsylvania do not have any facility that provides abortion care. We now have, because of the states around us that have put into place abortion bans. We have an influx of people coming to Pennsylvania, particularly here in Western Pennsylvania, to access abortion care. Our workforce is, healthcare workforce is stressed, and particularly with respect to those who are able to provide abortion care. So what we'd like to do, and what we know is safe and is being done in other states, is to expand the scope of practice for midwives, nurse practitioners, physicians' assistants, to be able to provide that care safely, and we know it can be done safely. As you all know, abortion is one of the safest procedures, medical procedures that we know of. And if we're going to expand access to make sure that everybody has access to abortion care, and particularly in our vulnerable communities, we need to make sure that not only is it legal, but it's going to be available. So that's the piece of legislation we're looking at, and I can tell you, as the new majority chair, all the crazy stuff that you've been seeing coming out of the legislature, coming out of the health committee over the past, really not just 4 years, but 24 years, stops now. We're going to begin to address critical issues that affect Pennsylvania's women and generally in healthcare, and we will have the voices like LaTasha Mays that will be front and center addressing issues that are critical to African American women, particularly with respect to the crisis that we see taking place with Black maternal health. So I look forward to working with all of you as advocates and my new committee members to advance good, rational healthcare policy that really addresses the needs of Pennsylvanians. So thank you.
Thank you, Representative Franco, for that information and for your leadership on the caucus. We're going to move on to our next question. This is also for all of our panelists. How can we ensure that incarcerated women, birthing people, are given the appropriate care during labor and delivery? For reference, House Bill 1419, the Dignity for Incarcerated Women Act, which was created in September 2022. So this is really addressing, going back to Representative May's inception, into this space of maternal health, and unfortunately, it's still an issue, right? Fairness and equity for mothers, women, and birthing people who are incarcerated. So this is open to all the panelists, so whoever wants to hop in. And,
yeah, can I jump in? Sure. Good morning. I am, of course, not at the state level anymore, but happy to join you all and happy to join this panel. I was, however, a part of the group of legislators who crafted and advocated for the Dignity for Incarcerated Women's Act. And that was not just one piece of legislation, and it's actually something that we have been working on for years and years. And finally, we're able to get a part of it through that was kind of taken from us, from the Republicans, through the House last year. But a part of that impetus for that are a couple of things. One, right? A group of us as legislators went to visit our women's facilities. We went to both Muncie and Cambridge Springs. At Cambridge Springs, we had a policy hearing where the women who were incarcerated at the time were the experts, and they were able to testify about their own experiences in ways that we had never seen before, because rarely do legislators go and visit their incarcerated constituents, but even less frequently do they actually listen to them as experts and learn from them and then apply what they have given us to make bills. But when we went to Cambridge Springs, for instance, we had a part of that panel. We had 4 women. I believe all the women were parents. They were all mothers. Some of them were geriatric, as in we had one who was 80 years old. About 2 or 3 of them had given birth in prison. 4 of them who were mothers of infants and babies. And of those women who had given birth in prison, right, none of them were in prison for anything that was a violent offense, right? These were a lot of women who had been dealing with trauma, who, were in prison on parole violations for not going to rehab, addiction, things of that nature. And they were forced to then give birth in prison because they were not able to, work through addiction at the speed at which the system believed that they should have been able to. These women were sleeping on pads that were about this thick. So imagine if your bed, your mattress is this thick and you are a pregnant woman, right? So they weren't given any separate accommodations, even considering the fact they were pregnant. When they give birth, they are given, I believe, 1 day to be able to be with their babies. If you are a mother, as one of them were on our panel, who had a baby who had an emergent situation, that baby was in the NICU for a couple weeks, I believe. That mother was sent back to her cell after the 24 hours, 36 hours when there is an emergency, I believe. That mother was sent back to her cell, and she was not able to contact anybody who was caring for that baby for a week, because they only get one point of contact for a week. So that woman did not know where her baby was for over a week. And then that baby was then sent to live with family members, and she didn't know until a week had passed. So those are all things that we need and can do to start to fix the conditions for birthing people who are incarcerated. Giving them humane living conditions, ensuring that they are able to have contact with their babies, and making sure that even when we think about our maternal health care crisis, when we know that women who die, Black women and babies who die in childbirth, they're not necessarily just dying in childbirth. It can be up to a year after, postpartum. So to rush and incarcerate a woman out of her hospital bed just to get her back to her cell without regards to her health needs is also something that we need to consider. So, right, thinking and creating bills, as this package of legislation aims to do, would aim to treat these women holistically, these birthing people holistically. So that's one thing. And we also talked about shackling, making sure that at the federal level, right, that no woman can be shackled, right, that no birthing person is separated from their infants immediately. Those are all things that we can be doing and that we aim to do at the state level. So I wanted to lift that up as somebody who was a part of that legislative process.
Thank you so much, and thank you for your leadership on this very important issue. But clearly there is still a lot of work that we have to do on this. So I'm glad it was a part of this panel discussion and food for thought for all of us as advocates for reproductive justice. Our next question is for Representative Kincaid and Representative Frankel. There was legislation introduced last session to ensure licensed professionals cannot be penalized for performing reproductive health services on an individual who resides in a state outside of Pennsylvania, where such services may be illegal. Can you talk about the expansion of this legislation to expand access to abortion health care? And I think that Representative Frankel, you kind of alluded to this a little bit, but if you and Representative Kincaid want to talk a little bit more about this, that would be great.
Why don't I let Representative Kincaid take this one?
Sure. So yeah, we introduced this legislation last session I want to make clear, no state to this point has passed legislation to say that they can prosecute somebody for seeking abortion care in another state. But there are a number of states that have considered it. There are a number of state legislators across the country in areas that have outlawed abortion or are seeking to outlaw abortion that brought this up as an additional step to prohibit women and birthing people who seek abortion care in states like Pennsylvania, where it's still legal, that they could potentially try and come into Pennsylvania and prosecute the women or the healthcare providers for providing abortion services to women from out of state. Say an extreme overreach of power from another state. So you know, we wanted to make it clear that no one is allowed to come into Pennsylvania and say what someone is allowed to do when it is legal in Pennsylvania. You do not have the right to prosecute our doctors, our nurses, and people who come and seek care in Pennsylvania. That is not something that you are allowed to do, because we want to make sure that people who need to seek abortion services can come to Pennsylvania and feel safe knowing that they can access it here. That legislation didn't move last year, but you know, we're reintroducing it again this year, and we'll see if we can get it through. The Senate would be the real block on that because it's still Republican controlled. But you know, I want to make clear that anybody who seeks abortion care services right now in Pennsylvania, whether you live in Pennsylvania or you live in a different state, is absolutely legally allowed to seek those services, and no one should feel afraid that they are going to be prosecuted for seeking abortion care services in Pennsylvania or providing abortion care services in Pennsylvania.
Thank you so much for that, Representative Kim K. We're looking forward to that new legislation coming through, and we'll be here to support in whatever way we can to push, particularly on the Senate side, to get it through. Our next question is for you, Representative Venkat. Coming into the state legislature with a medical background, especially in emergency care, can you talk a little bit about how you will bring experience into the work of creating legislation to support access to quality reproductive care, and why that is so important?
So thank you. I'm an emergency physician, and I'm the first physician in the General Assembly in nearly 60 years. And one of the reasons that I ran for office was seeing some of the ridiculous rhetoric around healthcare and the consequences of that in our communities, including the Black community. I represent the North Hills of Pittsburgh. I've practiced at Allegheny General on the north side for 17 years. And what I see on a regular basis as I continue to practice is that the social determinants of health, access to quality health, access to housing, access to food, access to equal and just reproductive care is absolutely critical to the overall health, not only of the individual, but also the community. And so my hope is, being a physician legislator and working with my colleagues and under the leadership of Representative Frankel on the Health Committee, is that I can be a voice about the realities of what's going on in the healthcare system. And specifically with regard to reproductive justice, in my career, I've actually seen a woman who nearly died from having a back alley abortion. It's something I never thought I would see in my medical career, nor should I have ever seen it in my medical career. And I greatly fear that that is our future without taking action and being a prominent voice to say that we can't allow that to happen here in Pennsylvania and beyond. And so I plan on using my microphone as a physician legislator to talk about the reality of what healthcare is and what it should be, and to advocate for policies accordingly.
Thank you so much, and thank you for stepping up and providing that leadership. I think it is critically important to have your perspective there, particularly in this space. So now we're going to move to Representative Lee. We have a question specifically for you. Your work as a legislator since you were first elected to the Pennsylvania State Legislature in 2019 has been rooted in racial justice and its impact on marginalized communities. Can you talk a little bit about how you'll be able to use your experiences to impact healthcare access at the federal level?
Certainly, and thank you for that. Let me just say, as we are in a new era, I would say in twofold. We are in two different ways. We are in a new era in healthcare and reproductive justice. That is the post-Roe era, right? Obviously, as a lot of my colleagues have mentioned, abortion care and access is healthcare, and it's critical. When we not only must we restore it, we must protect it, we must expand it, we must address gaps in it, such as the Hyde Amendment, which would ban Medicaid recipients from being able to access abortion care. But the reality is that there's another crisis going on too, and while we need to make sure that people have access to abortion, there are thousands and thousands and thousands of Black and Indigenous moms and potential mamas who want to be able to give birth without fear of dying. Without fear of their babies dying. And that maternal health care crisis is one that is almost unique to Black and brown folks, but it is an American issue that is only getting attention because of that. I'm someone who has a friend who died in childbirth as her baby. And when we see those statistics about that crisis, when we think about, as Dr. Venkit mentioned, those social determinants to health, when we think about the medical biases that Black and brown women and birthing people face when they are in the medical system, those are all issues that need our perspectives, that need that racial justice lens if we're going to address it. The reality is that the Dignity for Incarcerated Women's Act exists at the state level because of Black women and femmes, not just in legislation, but in advocacy. Formerly incarcerated women and femmes who have come and grown in their advocacy, who brings an urgency to the table, who brought that advocacy every single day, even when it was uncomfortable, to the Harrisburg, to the legislature, and they fought for that bill. The Momnibus Act at the federal level exists because of Black and brown women and femmes who are legislators, who are being responsive to their own communities, their own constituents, their own fears as mothers, as people who have gone through childbirth. And because of that lived experience, they legislate differently. We know that as Black and brown women, oftentimes, even with traditional organizations that focus on reproductive health, women's health, we know that, for instance, LaTasha D Mays, her organization, existed because of the lack of focus on Black women, girls, and femmes and reproductive justice, because of the lack of that holistic approach, thinking about our environmental justice, how that is connected, how environmental racism and education system and work and all those things play into our roles as mothers, birthing people. So that lived experience is so needed at the federal level when we come up with solutions, when we think outside the box, when we think about when we're legislating, we're standing in the gap. So that's how I plan to legislate, right? That's how I plan to continue to include groups like Healthy Start as we think about not just, bills that exist now, but thinking about where are there gaps that other legislators don't see because they don't live with us. So that's what my task is. And that's why I'm so grateful to have connections with you all, relationships with groups like yours, with groups like so many others on the ground. So I thank you all for your advocacy. I thank you all for your education, for teaching us as legislators, for helping us to see clearly all those gaps. We need more of that, but we also need more of us in office too, so that when we are advocating, we're already advocating and lobbying to people who understand fundamentally what our fight is.
Well, thank you so much for your leadership. And I think I speak for everyone when I say that we're excited to have you in Washington, D.C., being a voice and an advocate for us here in Western Pennsylvania. So now let's move on to our last and final question, and this is for all of our panelists. In the Commonwealth of Pennsylvania, we saw a 21% increase in maternal mortality pre-pandemic. And House Bill 1175, co-sponsored by Representative Morgan Cephas in the 2021-2022 session, required Medicaid to reimburse for doula care. This legislation centered around the issue of maternal mortality and addressing it. So the question is, reimbursement for doula care is a great win and medical benefit for women and birthing folks prenatal to postpartum. Doula is also support combating the disparities being addressed in House Bill 1175. How can legislation build on this to ensure private health insurance can include coverage and that the payments for birth workers is equitable? Anybody? This is for all of you, so anybody can jump in here.
Well, I would just say that the opportunity to actually move that piece of legislation, is finally a reality. It's something that I think is something that could get bipartisan support, and something that we could move out of the House Health Committee, and get to the House floor, pass, and I think would have reasonable prospects of getting passed in the Senate. I think it's critical. It's about expanding access, and I think the prospects of getting something like that done. We're looking. We're in the majority by one vote in the Pennsylvania House. As my colleagues have recognized, Republicans still control the Senate. So we have to look for things that we're going to be able to really accomplish. And I know the governor is focused on things that can get done. There are going to be other bills that we've talked about that are going to be meaningful, that we should pass out of the Pennsylvania Health Committee and get out of the House, that may not get to the finish line, but it'll at least get you to understand and hold other legislators accountable for their votes. And that's something we've been unable to do over the years. With respect to making sure that insurance companies provide coverage, I think we're going to be looking at mandates on a lot of different issues to make sure that we expand access to all different types of health care. And finally, one of the things that I think Emily may have talked about was the fact that Medicaid doesn't pay for abortions. One of the things I think we'd like to see, and we know that you can get done in other states, because there are a dozen other states that use their state Medicaid dollars to pay for abortion access. That's something we ought to be doing in Pennsylvania. I'm not sure that that's something that can get done here in the current circumstances, but I think it's something that we ought to be able to advance and give voice to, because we ought to be doing that. Even though we have the Hyde Amendment in Washington, states are able to take their state Medicaid dollars, which represent nearly 50% of Medicaid expenditures at the state level, and make abortion access available. Thanks.
Well, that's exciting. Again, thank you for your leadership. And I think I speak for everyone when I say we're excited at the possibility of this bill actually getting through this session, and also the expansion of possibly, providing coverage for abortion statewide. So that's exciting. I'm looking forward as an advocate to supporting that, as well as everyone here. Again, I just want to thank Healthy Start and the CAN Network for inviting me to moderate this panel. It has been very informational and educational. And I appreciate all of you, our state legislators and federal legislator, for joining us for this very important conversation. And we look forward to working with you as we move forward and fight for reproductive justice and better Black maternal health. And I will now turn it over.
Good morning, everyone. I'm going to introduce LaTavia Michael. She is the Community Action Network co-chair at Healthy Start. She is a community health advocate, mentor. LaTavia's mission is to work with organizations she serves to build the unity in the community. LaTavia resides in the far east side of Pittsburgh, east of Pittsburgh. Now we're going to have LaTavia Michael.
Hello, everybody. I want to thank all of the congressmen and women who preceded me and for all the hard work that they are doing in this. I want to thank Healthy Start for allowing me to be here and be a co-lead and a volunteer with them, because they actually are very helpful in was instrumental in my story. So my third pregnancy started out like any other pregnancy, months after of morning sickness, afternoon sickness, evening sickness. My body rejected everything that I put inside of it, but still I was growing a pretty healthy baby. Towards the, I want to say, heading into the final trimester, right before my final trimester, I went in for a routine checkup. I was hearing the machines go crazy. It was just, it wasn't normal for me. I mentioned it to the doctor. They agreed to do some tests. Well, in the midst of those tests, they found out that my baby had a small hole in his heart, and they wanted to admit me because they felt like I was under a lot of stress. Their goal was to hold me for a week and then induce me, because then it will get me closer to that final trimester. But that evening, my son decided that he wanted to make himself known. I went into labor. They rushed me into the OR, not the OR, the operation room for labor and delivery. In the process of being rushed there, I was telling them that I had to vomit. I'm like, I have to vomit, I have to vomit. All of the nurses like, oh no, it's just the fluids in your arm. Everybody said that you don't need to vomit. My spouse at the time looked at them and said, no, she says she has to vomit, she has to vomit. Ended up vomiting on the delivery table. In the process of me vomiting on the delivery table, everything just went haywire. The machines were going crazy. People were moving around frantically. I really can't tell you what was happening. I just heard a lot and saw like just a lot of fast movements. I heard my spouse at the time say to the staff, I know you're going to save the baby, but please make sure you save my wife also. I saw through blurred vision them roll the incubator out of the room. I want to say I passed out, and then by the time I came through, I was in a room by myself with nobody around me, no nurse, no doctor, not even my spouse at the time. When I looked up, I want to say about 10 minutes later, he walked in, he went and grabbed the nurse. I started inquiring about where's my baby? Where's the baby? Where's the baby? They told me that he was blue, he wasn't breathing. They had to take him to NICU. I said, okay, well, I want to go see him. And they looked at me and they said, well, he's going to be okay. He's in the incubator, but you just had surgery. You can't go see him right now. You have to wait till whatever they put in my system wears off. I'm like, okay. I kept asking. They said, oh, a little later, we'll take you. I want to say it was about 13 hours later that they finally took me down to NICU to see my baby, and it was closing in 5 minutes. So NICU has hours. So I literally got to look at my baby in a machine for 5 minutes. I'm looking at my baby. I'm seeing him do all that movement with his mouth, and I'm like, he's hungry, he's dehydrated. He didn't look quite like my typical other babies. And they told me, well, he's on NPO, nothing by mouth. There are liquids in the IV, they'll take care of it. I said, well, I would really like to breastfeed my baby. When the NPO order is lifted, can you please come get me so that I can breastfeed him and get my bonding with him? Next day came, had to wait a few hours to go see the baby. When I walked in to see the baby, actually rolled in because I couldn't walk. They were holding my baby. Nurses were holding my baby, and there was a bottle in her hand. I was instantly upset. I reiterated that I specifically asked to be disturbed when it was time for his feeding, and that I specifically wanted to breastfeed my child. They explained to me that his sugars dropped in the middle of the night, so when the NPO order was lifted, they felt it was best to not disturb me and to provide him with the nourishment to get his sugars up. I just accepted it. It's my baby. I haven't even held my baby. Like the that I just want my baby. I want to say by the time we got to me being able to hold my baby and me being able to bond with my baby, he had already been 24 hours old. That cut into a lot of that initial time, to the point where in the postpartum after him, I suffered postpartum depression. I walked away from my child and my responsibilities, and it was all because of that whole factor of I had no attachment to my son. I wasn't producing milk properly. I ended up getting extremely sick and ended up back into an emergency room a few hours later, not hours later, but a few months later because of the surgery. So I ended up with an emergency C-section, and they cut too high in the emergency C-section. I ended up getting a blood clot that traveled up to my lung. I ended up hospitalized for a week because of that blood clot. After being hospitalized for that week, my milk production even decreased even more, to the point where I felt no connection to my child at that moment. It was hard for me to parent. It was hard for people to understand that. And it was even hard for me to understand how that, because I love my kids, I'm a great mom, how that could have happened. And where I didn't get the experience with that one child that I've had with my other children, I want to say that the C-section, all of the trauma, suffering, my wishes not being respected in the hospital, I found it hard for me to bond. And truly, my birth plan wasn't respected. Nothing that I wanted to happen with my child was respected. And I couldn't bond with my child. Couldn't bond with my child. Couldn't connect with my child. I lost that intimate connection. I understood the health concerns, but I do believe that the other factors played a part, not being able to hold him for 24 hours. Like, even when I went to go see him, I still couldn't hold him because he was in a machine. I blamed myself for a lot of his conditions, even though I didn't even know how they could have happened. And all of that deteriorated me mentally from being able to connect with him and be a parent. There was no support to tell me you're going through postpartum. I didn't learn until after he was 1.5 years old that postpartum was a thing. And how you can, if you suffer trauma during a delivery, it can cause that to happen. Because sometimes I look at him today and I can't believe that that happened to me. Like, I really walked away from my child, somebody that I love, somebody that I want, somebody that I care for. But in that moment, my brain wasn't registering that that was my child and he needed me. All I saw was just, why? Why am I here? And I just want to shine a light on Healthy Start initiative and their home health program, where the aides come into the home and they sit and they help. Pittsburgh Black Breastfeeding, they all help me reconnect and rebuild that bond with my son. And without these programs, I don't think I could have done that on my own. My doctors didn't understand when I told them. They instantly went to medication. So that, I think the injustice for me in this pregnancy was the loss of time and the lack of concern about the development during labor and postpartum. Thank you, guys.
Thank you so much for that, Latavia. I think that the incorporation of real people and real stories to the world of statistics that we know is haunting is truly powerful. And with that said, my name is Bernasia Young, and I'm a public policy advocate with the Black Women's Policy Center, and I will now be introducing Ms. Ashley Combs. Ashley is the Media and Government Relations Manager for Healthy Start, as well as a School Board Director for the Wilkinsburg School District and the First Lady of Wilkinsburg. Ashley, I open the floor up to you.
Thank you so much, Bernasia. And just another thank you to everyone who has been a part of this legislative breakfast so far. I think the conversation and the information has been really impactful. And again, thank you to LaTavia for being so vulnerable and sharing that story with us. This panel that we are about to get started on is going to include some medical professionals and folks who are just on the medical side, the care side, and working with families and Black women in the community. Our panel will include Tiffany Jimenez, who is the Vice President of Development and Communications for Planned Parenthood of Western PA. We have Dr. Sheila Ramgopal, who is the Medical Director for Allegheny Reproductive Health Center. Benita Pinnell, UPMC McGee, Director of Community Outreach, and Alicia Vervain, who is the Community Engagement Coordinator with the Midwife Center. So welcome, everyone. Thank you so much for your agreement and being a part of this conversation today. These questions are going to be open in general, so please feel free to just hop in if you would like to take the answer. So our first question: it is clear that racism plays a part in the reproductive treatment that Black women receive. What are solutions that hospital institutions, individual practices, and providers in general can implement to combat this problem?
Okay, I guess I can start. Oh, I guess I'm like Dr.
I'm Sheila. I'm the CEO at Allegheny Reproductive Health Center. I use they, them pronouns. I'm an OBGYN, practice OB, and I'm also an abortion provider. So Allegheny Reproductive, was founded in the 70s. Abortion is central to what we do, but also it's very important that we do provide our care in a human rights framework and an RJ framework. I think in terms of the question, thank you for that question. Hospitals, first we need to shift policies and protocols. I think that all of our obstetrics is one of those fields where people are really dehumanized, and we're trained in a way to dehumanize our clients. And it especially affects people of color, queer folks, especially Black women. So it's very important that we shift all of that into that RJ human rights framework. In terms of providers, we're not trained to shift the power. Doctors, providers are very much about like, we hold the power. We have to shift that into providers actually being the bodyguards. Like I tell our clients, like, we're your bodyguard. I think it's very important that we no longer hold that power and give the power back to the clients. I think that's extremely important. And how do we teach that in medical schools? How do we teach current providers to do that? How do we shift our practices to do that kind of work? And how do we rehumanize our clients in OBGYN, in all aspects of OBGYN? It's a very general statement, but yeah, other people.
I agree. I would also say, from my perspective, that it would be the acknowledgement and acceptance that racism actually exists within healthcare, from these health organizations, these practices, the healthcare providers, and that it's not just structural, it's also individual, and that the two of them are interrelated and they are mutually reinforcing. And so I think that the minute that these large health systems or these individual practices begin to acknowledge and realize that and understand it, then they can begin to address it and to really put it through that reproductive justice lens. And I think that will be helpful.
Like, I fully agree with that. And then also speaking about like social determinants of health, I really think it's just like, it's a way to sort of gloss over racism. Like, why don't we just say racism instead of social determinants of health?
Thank you. Yeah, call it out. We have to say it. If we're not naming it, how can we actually address it? So I do actually have a Planned Parenthood question for you, Tiffany. Planned Parenthood is oftentimes in the spotlight specifically for providing abortion services, but there's so much more to what is provided when patients are coming to Planned Parenthood. So can you talk about those services and how funding to the organization is used to support your clients?
Mm-hmm. Absolutely. We at Planned Parenthood certainly are known for providing abortions, and we do provide them, and we are happy and will continue to provide them as long as we can in each state where it's legal. But we also provide a lot of other sexual and reproductive health care services, as well as preventative care services. We do birth control prescriptions, education supplies, we do emergency contraceptions, we do pregnancy testing and counseling, we'll do screenings for STIs and have treatments for those. We do breast cancer, cervical cancer screenings. So we do everything that a healthcare provider in reproductive health should do. We also provide that. But we never want to shy away from the fact that we do also provide abortion care, and we believe fundamentally that abortion care is health care. And so that is an important factor of the care that we provide. As far as funding is concerned, we do receive state funding as well as federal Title X funding. However, none of those, either one of those funding sources can support abortion care. And so we do have an abortion care fund that we call the Vivian Campbell Fund, which we do raise money for, and that provides access to abortions for people who cannot afford it. And we just remove those socioeconomic economical barriers to that type of care. We also receive funding through foundations and individual donors, since we are a nonprofit organization as well. And because we are a health provider, we do get reimbursements from insurance companies for the services that we provide. And just to make sure we remove barriers from care so that everyone knows, it doesn't matter if you don't have insurance, all of our services are provided on a sliding fee scale basis based on your income.
Thank you. I think it's important to let people know we appreciate your advocacy to abortion is healthcare, but there's so much more to reproductive justice when we think about our care. So thank you for sharing that. This next question is open for all with healthcare access. As we see state legislatures across the country implement harmful laws restricting access to reproductive health services, how are your facilities preparing clients to stay aware of the care that they do have access to?
Well, I think first and foremost, with Planned Parenthood, our messaging is reassurance. One, that abortion is still legal in Pennsylvania. You can still get an abortion. If you have an appointment with us, your appointment still stands, and we welcome you to come and to receive your healthcare services from us. I also think that we are fortunate enough to be plugged into a system here in Western Pennsylvania with Allegheny Repro, obviously Healthy Families, that we can make sure that we are raising awareness and advocating on behalf of our patients and the communities that we serve about these harmful laws and restrictive policies that are being introduced and trying to be implemented and passed in our area.
I can speak to this as well. This is Alicia from the Midwife Center. Sorry that I'm off camera. But one of the things that's really crucial in this topic is that midwives are able to provide abortion care. Like they do have the other non-physicians, they are trained and fully capable of providing abortion care. It's within the scope of care and credentialing that healthcare providers have, but they are prohibited by the language of state laws, which legislators have the ability to change. So that's just one of the things we want to keep in mind, is that midwives are fully trained and capable to do so much more than we allow them to. But we have the power to change that.
Thanks, Alicia, for that. One thing here at Allegheny Reproductive is we really try to make training for abortion accessible to everybody. So we train all types of medical providers, including you know, doula, oh, no, sorry, not doulas, but in terms of like PAs, nurse practitioners, and midwives, in terms of how to do DNCs. Obviously, DNCs are the procedure that we use both for abortion and also for all kinds of other reproductive health care. So it's really important that we're making that accessible. The other thing that I really want to emphasize is that medication abortion is also extremely safe and extremely accessible right now in Pennsylvania. And also for states where abortion access is limited, there are other organizations such as Aid Access, where you can actually order medications. So I know that previously, you know, some of the policymakers were talking about, you know, illegal abortion or self-managed abortion. Self-managed abortion is actually extremely safe, especially when we are accessing that medication with mifepristone and misoprostol or misoprostol alone. So I know there's a lot of media coverage right now regarding mifepristone having FDA restrictions depending on like a Texas decision in their Supreme Court. So misoprostol alone protocols and Miffy and Miso are extremely safe and effective. So for folks who are self-managing, it's also still going to be very safe if we can have access to those medications.
Thank you. All right, so the next question, unintended pregnancies are highest among the poor, the young, and Black women. Black women have more than double the unintended pregnancy rate of white women. What are ways we can support family planning for those most in need?
I think education, awareness, and access. The younger that you start having these conversations with individuals, the more informed they are and the better decisions that they'll make. I think that when you offer age-appropriate sexuality education to a curricula, then you give that student medically sound, factual, informed advice, and then they can make better decisions possibly before they become sexually active. And I like to applaud the Pittsburgh Public Schools on revising their comprehensive sexuality curricula and stating that abstinence is no longer the expected norm. Like it's catching up with reality, unfortunately. I mean, you know, and so, you know, and that they updated the policy to say that, excuse me, to make it that it was more, to make it more developmentally appropriate, medically accurate, and inclusive, anti-racist, and culturally responsive. And so I applaud them for doing that. And I think that that is one of the best ways that we can help to raise awareness with these young individuals, start earlier.
Another thing I'd love to add is how do we rebuild trust with clients in the medical system? So how do we shift providers' perspectives like we talked about previously so that people actually trust going to those providers to get this type of care? And how do we have providers deliver this counseling in a way that's non-judgmental and accessible? Like stating if you're 20 years old, you haven't had a certain number of children, you can't get your tubes tied. Or because you are a Black woman and you've had 3 babies, you should get a tubal ligation or you should get an IUD. It's like, how do we actually shift providers to recognize their internalized racism and how they, you know, translate that into their care? I think, how do we rebuild that trust?
I also want to point out that I really think that it's important with the concept of cultural competency to also think about the cultures of the different generations. You know, if we're trying to reach out to the youth of right now, we do have to realize that they have lived in a completely different set of circumstances than any of us ever have. And a lot of the resentment between generations just gets in the way of actually fixing problems, having accountability, and moving forward to provide a better future for our children. So as long as we realize that there is also that cultural competency concept with the just ages and what these generations have experienced versus previous generations, I think can really help our communication issues between them. Like there is sort of a language barrier of distrust and power over and power under that we can work through so that our youth actually feel safe to talk to us, which is incredibly, incredibly crucial.
I also just want to add one more thing, if I can. Okay. Also, I would like to say, as healthcare providers and advocate for reproductive health care, I think it is our responsibility, as I said before, to continue uplifting the bills and unpopular decisions that are being made by state legislatures all the way down to school boards, and to raise that awareness so that we can hold those people to account and hopefully affect change.
Yeah, no, thank you so much for that. And I appreciate you even mentioning the policy change from the Pittsburgh Public Schools, because I think, you know, that in itself, we've gotta have the bold conversation so that our young people know the truth and the facts of what is ahead of them and what's at hand when it comes to their reproductive health care. So this next question is in a 2015 report. Rochelle referenced the same report in the last panel, but in a 2015 report from the National Black Women Reproductive Justice Policy Agenda, it shared that Black women were 6 times as likely as non-Hispanic white women to be diagnosed with chlamydia, 12 times as likely to be diagnosed with gonorrhea, and 5.5 times as likely to be diagnosed with primary and secondary syphilis. What preventive measures can be taken to decrease exposure and support education about STIs?
Well, I'll just go back to the same thing I said before: education, awareness, and access. Making sure that people are educated about the risks of these diseases and how they're contracted, and making sure that they're aware that there are places that they can go to receive treatment and preventative care, and just educating the community about that. I'll let Dr. Rampaugh speak on it further as a clinician.
No, yeah, I totally agree with Tiffany for sure. And then also, so that folks understand the long-term repercussions of what happens if we don't get treatment for gonorrhea and chlamydia and these types of STDs. Obviously, it can affect fertility. And so my question is like, why is this happening? Why are people not able to access, STD treatment, prevention? Obviously, it affects our long-term fertility. And then going back to fertility issues, people of color, especially Black women and queer folk, can't access fertility care, right? So what's going on? What is all this? But how do we actually, create safe spaces also where people feel like they can go get testing and treatment without judgment, and to know that they're safe to access that treatment? Does that answer the question?
Yes, thank you. For me, even looking at those statistics, I was just taken back, like, wow, what is not happening? And to your point with access, oftentimes a lot of us think people can just go down the street to a facility and get care, but whether it's they feel ashamed, or they don't feel, safe, or that someone actually cares about their needs. And so bringing that to the forefront and making sure we know it doesn't have to be that way. So this last question that I have is surrounding birth workers. Birth workers like doulas and lactation specialists are core members to a woman or birthing person's birth plan. How do we improve working relationships with patient care teams when giving birth in hospitals?
I'm going to tag Alicia in here. Alicia, as a doula.
I am. Give me 2 seconds because I'm parking, and then I can be on camera again.
You gotta love the virtual life.
I mean, just to fill in the gap until Alicia's ready, places like Healthy Start, Allegheny Reproductive, we're all doing work to ensure that doula care is accessible. So I know that all of us have grants to support folks who are, especially people of color, to access doula support. Obviously, there's a lot of advocacy right now to have doulas being a reimbursed service, and we're trying to negotiate those rates. And there's also statewide and national organizations who are doing this work. Having doulas is extremely important for birthing people because doulas are your bodyguard. If you don't have a provider who's going to act as a bodyguard, the doula is your bodyguard. And then on top of that, having lactation specialists, especially, and all of this is, we need providers, doulas, and lactation specialists who reflect the community they serve. So we need to have more folks who are diverse, culturally competent, and work in an anti-racist framework. Obviously, Alicia's done some amazing doula work, so I'm excited for her to tell her story.
Yeah, so one of the things that I think is really huge for this, like we mentioned, is access to doulas, and just recognizing how much discrediting that has been done over career paths that have been primarily dominated by like women, and how those have been consistently discredited, from doulas to midwives. So one of the things that we can do is really have some state and institutional investment in funding scholarships for Black and other BIPOC birth workers, elevating them to positions of real supported leadership, ensuring this critical mass of peers around them, and encouraging the fact that you're supposed to have a team. That I think that's really what it fundamentally comes down to, is that you should have a team when it comes to something that is as life-changing as pregnancy and birth and loss. I mean, these are not things that we are meant to go through alone. And that's fundamentally what birth work is about. It is about not going through some of the most major transformational, beautiful, potentially traumatic moments of your life alone and without support. We weren't meant to do that. And being able to put the funding towards providing those and teaching people that they exist and are options that will change things, not even just theoretically, they will. I think it's really, really crucial.
Thank you. Thank you so much for that. So that wraps up our questions that we have for our panelists. I'm not sure if anyone who is listening has any questions that they would like to send through in the Q&A option. You do have that option to do so. We are really just appreciative for everyone who has participated today and has been able to be a part of this conversation as we talk about reproductive justice and how we improve access and quality health care for the communities that we are serving in all of our respective roles and the work that we do for the community. So I feel like these 2 hours have gone really quickly, but in a good way. And so I think we are getting to the end of our agenda for today. So our CEO for Healthy Start, the lovely Jada Sherrill, will come on and give us some closing remarks for this morning's breakfast. So there you go.
Thank you, Ash. Thank you, folks in the audience. Thank you for everyone who has contributed to making this yet another wonderful legislative breakfast hosted by our Community Action Network. What I really got from this is turning passion into political purpose, and how all of our work starts from a place of passion, of hard work, of past experience, of lived experience. And it's important that we are engaged in our political process so that we can impact those who oftentimes are voiceless, those who are the most harmed. I've learned so much. I am challenged, and I challenge you to think about something new that you've learned and how you can dig deeper into whatever that new piece of information, that new topic, that new fact is, and get involved. Get involved in having conversations with each other. get involved in reaching out to your elected officials. Taking off my Healthy Start CEO hat, I'm a mother, I'm a citizen, I'm a taxpayer, I'm a voter. So it's really important for me to get involved in that way. And putting my Healthy Start CEO hat back on, it's really important that we not only deliver services in community, but we educate the mothers, birthing people, and families that we serve on the importance of them understanding how our political process affects them personally and their care, and the voice and the influence that they can have in telling stories like we had today. Thank you to LaRasia and LaTavia for sharing your stories. There are so many important messages and takeaways that were shared today. A few of them for me were that we can't abandon our mothers who are incarcerated. So thank you, Summer, LaTasha, and all of our legislators who are working to make sure that our mothers who are incarcerated have a voice. Important health policy and access to abortion care was shared. That it's necessary to use a racial justice lens in addressing these health and human rights issues that we're also passionate about. That's really important. Humanizing obstetric care. Thank you to our First Lady of the City of Pittsburgh, Michelle Gainey, for kicking us off and using your positioning and also your personal passion to raise awareness for reproductive justice. Of course, thank you to our keynote, LaTasha, my sister, for always setting the tone, for reminding us of the transformative power of reproductive justice, and for reminding us to uplift Loretta J. Ross. To all of our legislators, thank you for your leadership and what are often, unfortunately, contentious human rights issues that really shouldn't be contentious. Thank you again to our panelists for your vulnerability and sharing your personal stories. It's really important that we put a face to those personal stories, and you have done that, so thank you. It's also good to see that you've gotten the support that you need and that you in turn can now be a voice and a support to other folks who may have the same experiences, but ultimately to eventually prevent those same experiences from happening to others. Thank you to our Healthy Start staff, board, funders, and lastly, of course, to our Community Action Network. This was yet another impressive and impactful legislative breakfast. I am almost an audience member, just like the rest of you. The team did all of the heavy lifting. It was fabulous. We got so much good information, such a strong call to action, and really education on the policies that are critical to the families that we all collectively serve. So at Healthy Start, our growing systems change work is organized around our emerging plan, which is the Allegheny County Birth Plan for Black Women and Babies. Hopefully you've heard about it. If you haven't, you can go to our website and navigate under our community programs and download it and take a look. But it provides actionable targets for our desired areas of policy focus, which are workplace rights, reproductive rights, and the importance of Medicaid expansion, which we recently celebrated in the postpartum period. And then finally, I invite you to join us next month as we celebrate Black Maternal Health Week, which is an annual event. And the 2023 theme is Our Bodies Belong to Us, Restoring Black Autonomy and Joy. And so on April 15th, Healthy Start will host a Black Birth Expo at the August Wilson Center. It is free to the public. And the purpose of that event is to create a space where we can celebrate Black birth, where we can bring together birth workers. So we heard a lot about the need to create your birth team. We heard about the importance of doulas. We heard about the importance of midwives and really the importance of having a choice. And so our Black Birth Expo will provide resources to families, to community, to anyone who wants to learn more about and celebrate Black autonomy and joy. So again, that's April 15th at the August Wilson Center from noon to 6. There will be vendors, there will be education. We have our keynote, Kristen Farmer, who is the founding chief executive officer of Birthing Beautiful in Cleveland, and she has since moved on to do more community-based work around preparing and supporting birth workers. We have many of our local favorite speakers, Muffy Mendoza. We have a Queen Watkin Wise, Tamaya Bridget. So please come out, join us. It's again, a free event, and it's a day of really putting this work that we're all talking about into action. So thank you so much for spending this 2 hours with us. I think you might get 5 minutes back. Use that 5 minutes to reflect, like I said, to dig deeper and think about how you can continue your involvement in this movement work. Thank you, everyone, and have a great weekend.